Karina, my name is Wendy and I will be your nurse today. I hear you're experiencing some pain. Could you tell me the location of that pain and on the pain scale 0 to 10 what it would rate?
Sí, me duele mi hombro, tengo mucho dolor. Es un 6.
Sorry, I didn't understand that completely. Do you understand English?
Un poquito.
Do you speak English?
No.
Would it be okay if I brought an interpreter in so I could provide the best care for you? How comfortable was that experience?
Well, for me that was pretty comfortable, especially since you gave me the choice to have an interpreter right away instead of trying to struggle with what I was trying to tell you. And it gave me the sense that you really cared about what I had to say and that you wanted to know so you could give me the best care. If you hadn't asked for an interpreter, I think definitely we both would have struggled and I would have felt more stressed out because you wouldn't understand me.
Okay. What challenges do you face as a patient with an interpreter?
Well, most of the challenges that I face would be not being able to understand certain medications, how I should take my medication, why they're important, also procedures that I'm about to do or like things that I need to fix in my health or my lifestyle to improve my health. So those are the biggest challenges because those are the main reasons that I need to come into the hospital or into the clinic. So those are the things that I've struggled with so far.
Okay. And do you think there's a challenge if nurse speaks to the interpreter?
Yes, there definitely is a block there because if the nurse is talking to the interpreter rather than the patient, it doesn't feel like they're developing a relationship. I believe that the interpreter is a good resource but shouldn't be in place of the patient. So that is important for me.
Okay. What is your opinion looking at the privacy aspect of giving out your medical information with another human being present, meaning the interpreter?
Sure. Well, I believe that if the HIPAA laws and confidentiality is carried out and the identification of the patient is kept private, then really I don't feel there's any danger or any need to worry. I think that you need to tell the doctor what you're feeling, what you're experiencing without having to worry about the interpreter. And most facilities do have confidentiality really highly prioritized. So I haven't felt any concerns with having an interpreter around.
Okay. Would you feel more comfortable using like an electronic interpreter, such as a computer monitor?
Personally, I probably wouldn't feel very comfortable with it because it wouldn't feel as personal as an actual person relaying my message to another person. I feel like certain emotions or feelings can't be expressed through a computer. Also, certain phrases in different languages are difficult to interpret. So I feel like a computer would be impersonal and wouldn't help the relationship of the nurse and the patient.
And like as far as tone, like we've mentioned that tone is gonna show how much the patient's in pain.
Yeah, definitely that's a big part of it, and if the nurse can take some verbal cues, that's great, but sometimes they can't because the language is just too different. And I think that with tone, really, a computer doesn't really have a tone that they care or that they're concerned, or urgency. Sometimes a patient will be more urgent in speaking about a certain topic, but a computer can't really translate that.
Can you tell me about a time, since I know your family's Hispanic, that you had to be the interpreter for a family member?
Yeah, I actually had to be the interpreter for my mom a few times, and she would take me along, and I would try my best to interpret, what's going on, trying to tell the doctor why she's coming in, but I would really find it difficult to explain to her what the medications did and what side effects, things like that. The big terminology words were the ones that I got caught up on, but the basic things we could get the message relayed and get a good translation. But I could tell sometimes my mom would get stressed because she knew I was struggling, and she also knew that the doctor was trying to give her an important message, but I couldn't really pass it on to her.
With the family interpreter, do you ever worry that if it's a severe situation, they might not say what the doctor is telling them?
I definitely think that can happen, especially depending on who the patient is. If the patient is a child and their mother is in the room, they might not give them the same information because they don't want their mother to know what's going on. Also, in a lot of households, the males have a lot of the say, so they are higher ranked, so they can really relay the message as they want or give the answer to the doctor as they want. It doesn't have to actually be what the patient says. So I think that that's one of the conflicts with family being the interpreter.
Okay, well thank you, Karina, for your time.
You're welcome.